Today I will be talking about oral anatomy and ear infections in dogs. We will start by going over oral anatomy. The dog's ear is made up of three parts: the outer ear, the middle ear, and the inner ear. The outer ear consists of the pinna and the ear canal. The pinna may be covered by skin, fur, or hair and is made up of cartilage. The ear canal is a funnel shape which helps to carry sound to the eardrum and is much deeper than a human's ear canal. The middle ear includes the eardrum and the ossicles. Another name for the eardrum is the tympanic membrane, as it is a thin membrane that separates the ear canal from the middle ear and is involved in hearing. The ossicles are three tiny bones called the hammer, anvil, and stirrup. The inner ear includes the cochlea and the vestibular system. The cochlea is the organ that transforms vibrations into a neural signal. The vestibular system is responsible for balance, spatial orientation, and head position. There are three types of ear infections. The first being otitis externa, the second being otitis media, and the third otitis interna. Otitis externa is the most common type of ear infection. It affects the external portion of the ear canal. Dogs with floppy or hairy ears may be at higher risk to developing this type of ear infection. Otitis media is an infection or inflammation of the middle ear. It is usually caused by an extreme case of otitis externa, which has spread to the middle ear, or it may be caused by the eardrum being punctured by a foreign object. Otitis interna is an infection of the inner ear and is an extension of otitis media. In extreme cases, it can cause deafness, loss of balance, or nerve damage. In this picture here, you can see the ear canal becoming inflamed and closed off due to an otitis externa infection. Here, you can see the middle ear being infected and filling with an inflammatory exudate. And here, with the inner ear, you can see during an infection it will become very inflamed. This is a picture of my own dog who had an ear infection a few years ago, and you can see that the outside portion of her ear became very crusty and she had a otitis externa infection. Here are some causes and symptoms of ear infections. Causes may be moisture, allergies, endocrine disorders such as thyroid disease, autoimmune disorders, wax buildup, foreign bodies, injury, and ear mites. Moisture can create the ideal environment for bacteria and yeast to grow in. Due to the L shape in the dog's ear, it will typically hold in moisture, especially if the dog has floppy ears, which makes it harder for the ears to dry out completely. Ear mites can also cause an infection, but it is more common in puppies than in adult dogs. Some symptoms include head shaking, scratching at the ear, dark discharge, a yeasty odor, redness, swelling, pain, itchiness, and then crusting or scabs in the ear. Ear infections should not be treated at home with DIY remedies, as damage to the middle and inner ear can have long-lasting effects on your dog's health, which is why if your dog starts to exhibit symptoms, you should take them to the vet. We will now go over the difference between an acute and a chronic infection. Acute infections develop suddenly and they usually last a short amount of time. Acute symptoms may include the dog scratching their ear, an odor change, or a combination of the symptoms mentioned on the previous slide. These are usually treatable if noticed quickly. Chronic infections are when acute symptoms go unnoticed. Conditions worsen over a long period of time and they spread to the middle or inner ear. Dogs may develop chronic otitis externa if symptoms are not taken care of quickly. Chronic infections may follow a pattern like seen in the image here, where the cycle continues even if treatment is given. This can be due to a primary cause like allergies, which is worsened by predisposed factors such as pathological changes and inflammation, and then a secondary cause like a bacterial or yeast infection. We will now talk about treatment. Remember to always consult a veterinarian for the proper treatment. A veterinarian may clip the external fur, clean or flush the ears, or remove hair from the ear canals under anesthesia. General anesthesia may be needed for cleaning or flushing out the ear canal. Removing hair from the ear is a painful process that should be done under anesthesia and not at home. Powders used for plucking hair from the canal can be irritating and should not be used during treatment. Your veterinarian may also prescribe a topical medication that should coat the cells along the ear canal. Topical medications need to be used after a cleaning because they can be deactivated by discharge or earwax. Topical medications may include antibiotics, antifungal drugs, and glucocorticoids. With bacterial infections, antibacterial drugs may be used with corticosteroids to reduce discharge, swelling, and pain. Your veterinarian may prescribe an oral treatment for long-term infections. The treatment will most likely be done until the infection is completely gone. In some cases, this only takes a few weeks, but in other cases, it may take months or treatment may need to be done indefinitely. Here are some examples of prescribed medications. The first one is Animax ointment, which is a topical gel medication that is used to treat acute or chronic otitis. It contains antibiotic, anti-inflammatory, anti-itch, and antifungal medications. The next one is Baytril, which is an oral antibiotic used when dogs have bacteria in the ears that are invading cells. Fluoroquinolone is present in this drug and interferes with the bacterial DNA metabolism to kill off the bacteria. The next one is clindamycin, which is another antibiotic drug that is used to treat serious infections and works by stopping the growth of bacteria. The active ingredient is clindamycin hydrochloride. And finally, there is cyanotic oidic solution, which is a prescribed solution used to relieve itching and inflammation that occurs during an ear infection. It also reduces swelling and redness that occurs during scratching. The liquid solution is distributed into the dog's ears and has a slow rate of evaporation which allows it to distribute and penetrate all parts of the ear. Remember that your veterinarian will know which treatment is right for your pet. Here are some steps to take to prevent an ear infection. Start by inspecting your dog's ears regularly and take note of any behavioral or physical changes that occur. Second, consult your veterinarian for the proper ear cleaning techniques. Your vet can show you how to clean your dog's ears at home as well as show you which products are safe to use. After your dog goes swimming, be sure to try to keep the ears dry and well ventilated. Keeping them dry and well ventilated prevents bacterial and fungal growth and will prevent the ear canal from softening. Using a vet-recommended drying agent after swimming can help reduce moisture. Also, when bathing your dog, try to keep water from entering the ears. Hair removal from the pinna may be necessary for ventilation, but should only be done if approved by a veterinarian. If it is needed, do not try this at home before receiving a demonstration from a qualified veterinarian or groomer. And finally, allergy identification may be needed if symptoms persist. Finally, these are the sources that I used to make this presentation. They have a lot of helpful information if anyone is looking to further their knowledge on this subject.